Hamstring muscle injuries are a frequent issue among athletes and active individuals. Particularly prevalent in sports requiring explosive sprinting actions like athletics, soccer, basketball, football and netball, which are all very common sports in the Sutherland Shire. These injuries can range from minor pulls to severe tears. After being a physio for almost 20 years, I have seen a lot of them, and to be honest, vast majority are 35-plus-year-old males giving soccer another crack on the weekend. The hamstring is comprised of three muscles that run down the back of the thigh: the semitendinosus, semimembranosus, and biceps femoris. These muscles originate from the ischial tuberosity at the base of the pelvis, cross the knee joint, and attach to the lower leg. They play a crucial role in extending the leg straight back and bending the knee. There are several grades of muscle tears, and they are varied times required to recover. Grade 1 tears, which are mild damage that heals quickly, usually within 2 weeks, and the size of the tear is under 10 mm. Grade 2 tear, partial tear requiring more extensive recovery, usually 4 to 6 weeks, and can be much larger in size. Grade 3 tear, a complete tear, representing the most severe form of injury which may take months to heal, and the tear extends from one side of the muscle to the other. Hamstring tears typically occur from muscle overload, such as when an athlete, weekend warrior, suddenly increases the intensity of their training or experiences an unusual load suddenly that the muscle hasn't been conditioned for. These tears often happen during eccentric contractions, when the muscle lengthens while contracting, common in sprinting, running, and jumping sports. Now let's talk about the potential risk factors associated with hamstring tears. Dehydration. Muscles can cramp, tighten, when they are meant to be lengthening while running due to dehydration, increasing the likelihood of injury. Muscle imbalance. Discrepancy in strength between the quadriceps and the hamstrings can increase the risk of injury. Poor conditioning and muscle tightness. Lack of strength and flexibility can make muscles more susceptible to injuries, particularly when it isn't conditioned for that amount of work or load. Muscle fatigue. Tired muscles are less capable of withstanding the stress of exercise, increasing injury risk. Age and activity. Adolescents in growth spurts and older athletes who do not regularly engage in stretching or strengthening may be more prone to injuries. What are the symptoms of a hamstring strain? Sudden, sharp pain during activity. Swelling and bruising along the thigh or behind the knee. Weakness in the hamstring that may persist for weeks. Should I stretch a muscle tear? This is a question we get asked a lot, and also something that we bring up early in the recovery process. The answer is initially no. We don't want to be further pulling on the damaged muscle fibers. This is often contradictory to how you feel. However, it's important to understand that once a tear has occurred, all the surrounding healthy muscle fibers will stay slightly switched on in an attempt to protect the torn fibers and limit tensile load. In other words, this tightness is a good thing and we don't want to stretch it out yet. Hamstring injuries require careful management to ensure full recovery and prevent future issues. Athletes, particularly in the Sutherland Shire, should seek professional advice and adhere to a rehabilitation program tailored to their specific needs. By understanding the risks and implementing preventive measures, individuals can enjoy a safe and healthy sporting career or simply the weekend kick around with mates.